Assalamu alaikum wa rahmatullahi wa barakatuh. I'm Bayan Hazazi and today I will talk about diabetes. These are my objectives for today. Firstly, I will talk about introduction and definition of diabetes. After that, I will talk about types and diagnosis of diabetes. After that, complications and prognosis of diabetes. And lastly, treatment and preventive measures of diabetes. So, firstly, the introduction and definition of diabetes. In these days, science improved a lot, but still now most of the people lack awareness about diabetes. So, what is diabetes? Diabetes is a chronic disease that occurs either when the pancreas doesn't produce enough insulin or when the body cannot use this insulin it produces. My second objective is types and diagnosis of diabetes. The first type is type 1 diabetes, called insulin-dependent diabetes. It's characterized by low or absent level of produced insulin. The second type is type 2 diabetes, is known as non-insulin dependent diabetes. Develops as a result of insulin resistance and progressive non-autoimmune beta cell failure. Gestational diabetes is hyperglycemia with blood glucose values above normal but below this diagnostic of diabetes. Gestational diabetes occurs during pregnancy. Also, gestational diabetes is diagnosed through prenatal screening. The diagnosis of diabetes can be established in one or more of four ways: random plasma glucose level above 200, fasting plasma glucose concentration above 126, and oral glucose tolerance test higher than 200, or HbA1c value above 6.5%. Confirmation can be made by the same test or two different tests. A fasting value above 150 is likely to distinguish between diabetic person from non-diabetic. My third objective is the complications and prognosis. The complications associated with all forms of diabetes and recommendations for screening are noted in the table. Thyroid diseases, celiac diseases, hypertension, dyslipidemia, nephropathy, retinopathy, and lastly neuropathy. Prognosis of diabetes could be by mortality. Younger age at onset of type 1 diabetes associated with increased risk of worse outcomes, including all-cause mortality. Nephropathy, incidence of end-stage renal failure after 20 years in patients with diabetes 1. Cardiovascular diseases occurs earlier in patients with diabetes 1 but not in diabetes 2. And lastly, glycemic control. My third objective is treatment and preventive measures of diabetes. Type 1 treatments usually include combinations of regular or NPH insulin and or synthetic insulin analogs. And for the treatment of type 2 diabetes, mainly people are preferred oral medications. For the prevention, management's concentration on keeping blood sugar levels as close to normal as possible without presenting undue patient danger. This can usually be with close dietary management, exercises, and patient education. And understanding and participation is vital since the complications of diabetes are far less common and less severe in people who have well management blood sugar. Take-home message: the diabetes epidemic is here and threatens to overwhelm health systems if left unchecked. Diagnosis, treatment, management, and prevention of diabetes and other non-communicable diseases require integrated health systems. These are my reference, and thank you for listening.